Hi, guys.
Hey guys, I'm Glenn, and this is Sarah. She's our nurse manager. So we had our marketing team post have a post on social media for you guys to ask us questions, anything dealing with the COVID-19 pandemic that we're all currently experiencing, and anything that other questions you had related to your cycle or what's going on with conceptions during this unprecedented time. So to get started, we got some questions from our patients or some of our viewers for us to kind of go over. So we'll dive right into it. So one of our first questions is, when will FBTS or frozen embryo transfers resume?
So the answer to that question is we're hoping that we'll be able to resume FBTs as soon as possible. We're still waiting for ASRM guidelines to come out, and so every 2 weeks, ASRM is updating their guidelines. In the meantime, what we're doing is asking patients to call us with their cycle day ones. Because we schedule these about 6 to 8 weeks out, once we become aware of when we'll be able to resume, we'll start the scheduling process. So that could happen in the next couple weeks. If we're hopefully up and running and able to resume FETs by this, early summer. So definitely call with cycle day one. We're tracking those guidelines on ASRM and are getting you guys scheduled and up and running as soon as we can. So.
And along those lines, the next question, will Doppler, HSG, and other diagnostic tests be performed in April?
Yeah, the answer to that question is yes. As a healthcare facility, we are confident in our ability to control infection and exposure in our office. And so our office has strict policies on how we're treating patients, seeing patients in the office, and making for certain that we are limiting exposure. So the ability to do those diagnostic tests is keeping you on at least somewhat of the same timeline as you would have been on. So the answer is yes, we're continuing to do those things.
And on the lab side, we are still doing endocrine testing. So to do a TeleMed Console with our doctors, you can still come into the office and get your blood work done. We are doing semen analysis. We started this new program where if you call us and you need a semen analysis, we will mail you a kit. So you can do a home collection and then schedule a time for you to drop that off to us. So it minimizes exposure to you and our staff, and we still can do the tests in our laboratory. If you do that program where we send you a kit and you drop it off, if your partner, if you guys want to have another consult with your physician, that consult will be 50% off. So just trying to get people, still engaged to start or continue their fertility journey. So the next question is, how will scheduling work once transfers are allowed again?
And how are we going to handle the backlog of patients? This is a really great question. We've been evaluating this every day. We're making several changes to the physician schedule as well as to the OR to accommodate, because we do expect that we're going to have a pretty large volume of FET patients once we can get back up and running. So a couple of things we're doing, just to let you know, physicians are going to be opening up their schedules to allow more transfers in a day. And we are opening up our second OR specifically to accommodate frozen embryo transfers. Those patients, I will say, those patients who were canceled during the COVID initial crisis, right, and that initial time when we canceled patients and had to, per ASRM guidelines, those patients are on the top of our priority list. So I want you to know that we will be handling those of you that were canceled first, obviously. And then as I said, opening up that second OR and the physician schedules to accommodate as many patients as we can, as quickly as we can. So.
Kind of similar question, but the next question is, what is the current ETA for things to be up and running again in general?
Yeah, a really complex question and a good and a complex answer. But I will tell you this, we've not stopped running as a practice. Your nursing teams and doctors have been continuously evaluating every patient, assessing every patient to make for certain that we're doing everything we can so as not to delay you any further. I think that's really important to know. We're trying to doing telemed health, telemed consults as well as diagnostic procedures, anything we can do, making for certain that diagnostically we're handling those things and making certain that those labs are in range, for your transfer, and those things are up to date, so that we don't have any further delays. So the answer to that is we've never stopped running. We did get a delay, but we've never stopped running. So,
and to expand on the lab side, we're basically business as usual. We still are going to be here every day to maintain quality control over the lab as far as your preserved eggs, sperm, and embryos. We have extensive procedures in place to do that even before the COVID crisis was around, so we'll continue to do that. All the tanks are alarmed, so everything's safe. We're still doing quality control on our equipment so that when we get the green light to start back up from ASRM, or whenever that decision is made, that we can hit the ground running. And we're still doing some egg thaw cycles, so we're not seeing those patients, we just have their eggs. So we have the ability to thaw those eggs and culture those out to embryos and cryopreserve those embryos, and then we can do those transfers down the road. And so we're still here almost every day. So if you guys have any lab questions, you can call the main number and ask for embryology. We're still here. We are following ASRM recommendations as far as we're doing team embryology now. So we split up in teams to try to minimize exposure to ourselves. But we already have procedures in place before the COVID crisis as far as wearing PPE, being very clean. That area where our lab is situated is probably one of the cleanest areas you can be in. And so we're doing either more extensive procedures to make sure that we're minimizing any exposure to the virus as possible, as we possibly can. Next question. What time frame should patients looking to start transfer or IVF cycles expect? What's the time frame?
Well, as you guys know, IVF cycles and transfer cycles are it's an in-depth kind of procedure anyways, right? So when you do expect to start a transfer cycle or an IVF cycle, you're looking at, it's a kind of a month to 6 weeks, up to 8 weeks commitment anyway. So we're looking again at each patient, identifying those patients currently whose outcomes could be affected, by an extended delay in treatment, and continuing to follow those ASRM guidelines, weighing both of those right now. So as you know, ASRM did update their guidelines. Are still giving the same guidelines, but what they did is add addendums to their guidelines in looking at patients and assessing those patients who could be affected by an extended delay. So we are doing that right now. So this is going to vary from patient to patient on any given day. And I can assure you that the nursing teams and the doctors are assessing every patient. So,
next question, are we still doing ERAs?
Yes, we are doing ERA biopsies.
Okay. That was pretty interesting. So next question, what can I be doing now to prep my body for success once I can start my retrieval calendar?
So everybody's circumstances are a little different, but generally speaking, and since we all have extra time on our hands at home, all of those things that we can do, we can be doing for our general health right now are going to help to improve the health, your fertility health. Eggs and sperm are certainly a cell in our body that's impacted by what we do to it. So right now, while you're at home, why not improve your health? Why not eat better? Avoid those foods that have chemicals that can be harmful to our bodies. You can definitely get outside and get a walk and those kinds of things. You know, and like I said, every patient is a little bit different. All patients can be taking some egg health vitamins and sperm health vitamins. If you don't have a list of those, please reach out to your nurses. We can get those for you, so you can absolutely be taking those. And those of us who maybe have a few pounds to lose, you know, or might be slightly overweight, you know, you can be doing those things right now to improve your health. And all of those things that you're doing to improve your health can improve your fertility outcome in the long run. So, yeah.
You know, next question, along the same lines, what can I do to prepare my body for a transfer? And what Sarah just went over is the same for the transfer. You know, if I could add anything is, you know, reducing stress. I mean, I know it's kind of difficult to do at this time, but anything you do to like be in a better place, physically, mentally, so that when we have these restrictions kind of lifted, or we decide as a group to move forward, that you'll be good to go. Next question, how will you ensure that my eggs, embryos, and sperm will remain safe in the lab? Again, we are business as usual. We have a lot of procedures that we do weekly to ensure the integrity of these storage tanks that we have. They're all monitored, you know, electronically and visually. Our embryology team, we top the tanks every week. We've also had extensive conversations with air gas, so we're considered an essential business, and that is crucial to maintaining life. And so we're at the top of the list as far as making sure that we get our liquid nitrogen tanks during this pandemic. And we've also went a little overboard, and we have extra tanks just in case, worst case scenario. But I can assure you, everything is perfectly safe here. Again, we're here every day still, so everything's all good. Next question is, what should I do if I become sick?
First and foremost, if you become sick, don't panic, okay? The vast majority of us will overcome this illness. So follow CDC guidelines, stay home, take care of yourself, get lots of rest, drink plenty of fluids. If your illness becomes worse, you need to call your primary care physician and talk to them and let them know how you're feeling, and they can determine whether or not you need to be evaluated. From a pregnancy standpoint, I know a lot of our pregnant patients, and we are managing a lot of pregnant patients right now, are worried and concerned about becoming sick. I will say that right now, what we know is that this virus does not pose an increased risk for pregnant women. Certainly we'll have more information in the next 6 to 12 months on how this can impact the baby in utero. But right now what we know is that it doesn't pose an increased risk. We do know, however, that infections that cause an increase in fevers can increase your risk for miscarriage. If you had a high fever, can increase your risk for miscarriage or fetal death. So the recommendation remains the same, and that is that you should follow CDC guidelines, limit your exposure, prevent the infection by washing your hands and taking good care of yourself. So, and if you're doing those things, then you should stay reasonably safe during your pregnancy. So,
and then some things that we're doing at conceptions, you know, we have some signs on our doors that say, if you have a procedure and you are sick, just call your nurse. Don't come to the office. And for our patients that are healthy, when you come to, we're only seeing the patient that the appointment is scheduled for. So we're not letting partners come in for any procedures or visits, any loved ones or children. We're asking those guys to stay in the car, kind of minimize exposure. We are doing temperature checks when you walk in the door, just to make sure you're not running a fever. And we're also, we are a healthcare facility, so we do practice good PPE use. We disinfect things on a regular basis anyway, but we also have ramped that up to, a little overkill as far as being as safe as we possibly can. So to protect you and our staff and all of our families, we're trying to minimize exposure as best as we possibly can.
Mm-hmm. Absolutely.
The next question is, do I have to pay a copayment for my telemedicine console?
So the answer to that is Conceptions is not. So I spoke to our business manager today. Conceptions is not collecting for that copay based on the insurance guidelines that we've received. But does that mean that your insurance company won't charge you for that consult? Every insurance policy is a little different. Your co-insurance and deductibles could be subject to that copay. For specifics on whether or not your insurance company is going to charge you for this, you need to call them. And every insurance is a little different, so just keep that in mind. So we will not be collecting for that copay, but that doesn't mean that your insurance company couldn't bill you for that after the fact. So.
And the next question is, how does the TeleMed Console work, and what do I need to access this console in my home?
So the TeleMed consults, we use two different platforms. One of them is WebEx and the other is Doxy. In order to be able to utilize that, you need a personal computer. I've heard of patients using their phones to do this as well. So I'm hearing that you can do this on your phone if you don't have that. So you need to have that and Wi-Fi. So if you have those two things, you should be able to do the TeleMed console. So.
And the last question that we got was, can I still speak to my nurses?
Oh yeah, absolutely. We're not going anywhere. We like our jobs. We like our patients. So we're here. We are definitely following strict guidelines. The government has asked us to stay home if we can. So currently I've got, on any given day, I've got 1 to 2 nurses in the office and the rest of them are working from home. So I have a nurse here and available. If you have an urgent situation come up, we have nurses that are here to help you out. Your nurses are still available by email. We're still available by telephone calls. So reach out to us. We're here. And honestly, we want to see you guys go through too. So I know some of you have been with us for a while. So we love what we do. We want to continue to help you guys. Reach out to us. We're here. So.
And then in that same aspect too, one little pointer I might throw in is, we embryology team, we're also working in teams, so we always have 3 embryologists on site every day, but then the other 3 of us are at home, and so we're still working from home. So I've actually tried to reach out to a couple patients, and they didn't answer, and then they sent them an email, and they said, well, I didn't answer because you had a weird phone number. So just keep that in mind. So if you're kind of expecting a call from us, if it's a weird number, sometimes I answer it. It might just be our personal phone from home. So yeah, we want to get in touch with you. We want to, we pride ourselves in having good patient, relationships. So we'll be calling you guys a lot, and so just answer your phone. And so that concludes the questions that we got today. We may do this like next week. Maybe we'll have our marketing team's done a great job, Cindy, Erica, and Jackie, and so we might have them post another series of posts so you can like type in a question. And so maybe next Friday we can do this again if we get enough questions, because things change day to day. Like we're right there with you guys. We think that we know what we're doing, and things change the next day. So we'll try to keep you guys updated as much as possible. As soon as we know, we'll try to relay that information to you guys. So until next time, stay safe, stay healthy, and we'll talk to you soon.
Take care.
Bye.